Thank you, Madam Speaker. Death of more than 100 mentally ill patients in Gauteng province last year has deeply shocked the nation, and the ACDP joins people across the country in expressing sincere and heartfelt condolences to families and friends of the deceased. This exposure of the department's lack of monitoring, capacity and budget, societal neglect and Parliament's inadequate oversight is devastating, and we stand collectively responsible even as we interrogate the situation to make sure nothing like this ever happens again. The decision to terminate a contract between the Department of Health and Life ACDP, a service provider that had been delivering healthcare services to indigent patients under contract to government for over 50 years, we are told, has had horrendous consequences and forced us to take stock once again. So many life and death decisions are taken at a policy, financial and admin level without enough awareness and consideration for the sanctity of human life. Around 2,000 people who were receiving highly specialized chronic psychiatric care had to be moved to families, NGOs and psychiatric hospitals, and the way in which they were hurriedly discharged en masse has resulted not only in the breach of their rights under the Constitution and the Mental Health Care Act, but a death sentence. The bottom line was money, of course, but lack of budget. But there was also a policy imperative to deinstitutionalize, two factors which placed Treasury and ANC's policy-making body in the mix of those responsible. This is a national tragedy. We are all implicated in some way. Yes, there must be political, civil, and criminal accountability and inquests into all deaths to establish the causes and the appropriate steps that would follow. The removal of all surviving residents from unlicensed and incapable NGOs is non-negotiable and must take place immediately, but it must be safe, dignified facilities, and this will cost us. The ACDP calls on government urgently investigate how patients went from licensed institutions to unlicensed ones, and to review and amend licensing policy and practices where necessary as they apply across the country. The ACDP also calls for a review of policy on institutions, on plans for mental health care services countrywide, and an increased focus on monitoring and compliance. This may have happened in one province, but our eyes must be on all. The ACDP has for the past few years been pleading with government to respond adequately to the plight of vulnerable people with regard to special housing needs. This includes mentally ill people, and we again call on government and Minister Sisulu to prioritize the approval and implementation of special needs housing program policy that has been waiting 15 years for approval before some other avoidable major disaster also ends in tragedy.